Question number 4, Dr. Paul Hutchison. Order. Order. I've called Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Associate Minister of Health, how will young New Zealanders receive better mental health services under the new government package announced by the Prime Minister today?
The Honourable Peter Dunn.
Mr. Speaker, the Prime Minister's Youth Mental Health Project is an extremely comprehensive prevention-based $62 million package designed to provide practical support to young people and their families in dealing with the complex issues involved in adolescent mental health problems. It includes an additional $11.3 million over 4 years to be made available for primary mental health care, including initiatives targeted at young people with mild to moderate needs. The Ministry of Health will be investigating ways in which primary care can be made more youth-friendly. An expert group will be set up to work in partnership with the primary care networks to ensure that happens, and jointly with social development there will be the establishment of interim support for youth one-stop shops, ensuring that these organisations have sufficient administrative support and security of funding. And finally, Mr. Speaker, child and adolescent mental health services will be charged with improving waiting times and, along with primary care providers, ensuring a far more consistent approach to follow-up care.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. How will young people and their parents experience better access to youth mental health services as a product of the Prime Minister's Youth Mental Health Project?
The Honourable Peter Dunn.
The project's designed to work in 4 different places: in schools, online, in families and communities, and in the health system. There will be nurses and specially trained youth workers added to selected schools to help students who need appropriate care. Existing online mental health resources will be overhauled and a social media innovations fund put in place to keep providers technically up to date. And because it's often difficult for parents to identify mental health issues in adolescence, we'll also be providing more funding to NGOs to assist them get more information out to parents about what to look for and how to access help.
The Right Honourable Winston Peters.
Could the Minister explain why a highly qualified, experienced doctor like Dr. Paul Hutchison is not the Associate Minister of Health or Minister of Health, because he has qualifications, and yet he with no qualifications is, or was that part of the deal he did with John Key before the last election?
Order. Order. The Associate Minister has no responsibility whatsoever for the allocation of portfolios, no responsibility whatsoever. The member's welcome. I don't deprive the member of a question, but he needs to bring his question within the responsibility of the Associate Minister of Health, and portfolio allocation certainly not. The Right Honourable Winston Peters.
Oh, really? We'll see who's learner shortly. Mr. Speaker, could I ask the Minister this? Given that Dr. Paul Hutchison is a very experienced, highly qualified medical doctor, well renowned around this country for having the abilities to be an Associate Minister of Health, and he is not, why did he not decline the job when he asked for it and it was offered to him by John Key before the last election?
The Honourable Peter Dunn.
Mr. Speaker, I accepted the invitation to take up this portfolio role because I believe very strongly in the initiative that's being produced today. And in fact, I say to the member, one of the initiatives that it contains, the introduction of youth one-stop shops, is actually part of our confidence and supply agreement.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Associate Minister, how will the success of the project be measured?
The Honourable Peter Dunn.
Mr. Speaker, it will be measured at a couple of levels. Firstly will be the success, if you like, in terms of uptake and in the improvement in adolescent mental health generally. But also the Prime Minister's made a commitment which will be carried through, that the whole project will be evaluated in 2 years' time to assess how it's working, what changes might be required and what refinements might be made, because the fundamental point that comes through in this is that we have a severe issue in New Zealand. We need to do what we can to boost and improve youth mental health services, statistics and performance, and in fact the commitment of this policy is to achieve just that.
Ian Lees-Galloway.
Thank you, Mr. Speaker. Supplementary. Given that one of the key drivers of youth mental illness is childhood poverty, why has the national-led government allowed the number of children living in poverty to increase by over 34,000 since it came into office?
The Honourable Peter Dunn.
Speaker, what the member should draw upon is the answers given earlier today by the Prime Minister, which indicate the significant impact that tax changes have had in improving the living standards of the most vulnerable New Zealanders. But what this package is about is addressing the needs of those who have severe problems, who are currently untreated, who currently do not have access, and by having a comprehensive program operating across a range of portfolios, Mr Speaker, we're going to see significant improvement.
Question number 5, the Honourable David Parker.
Thank you, Mr Speaker.